Stroke Smart on ABC 27 is presented by the Penn State Hershey Clinical Neuroscience Institute.
And welcome back. Now joining us is Dr. Kevin Cockroft, the co-director of the Penn State Hershey Stroke Center. And Dr. Cockroft, we talked a lot about medicines for stroke prevention, but when the medication used to treat the high-risk factors, when they don't work, what can be done? What do we do then?
Actually, there's quite a few other things that can be done these days. And one of them was the treatment that Mr. Webster mentioned that he had, and that's to use angioplasty and stenting in the brain arteries. Now, this is started off in the arteries of the heart, but now we can also do the same thing in the arteries of the brain. And that's the main thing for ischemic stroke, one of the things that we can do in the brain. Now, for the hemorrhagic types of stroke, the other type that Dr. Reichwein mentioned, we can also do treatments to prevent those as well. And the two main things there are aneurysms and AVMs, or arteriovenous malformations. And what we can do with those is to use treatments either from inside the blood vessel to plug up or close off the aneurysms, which are like bubbles of the blood vessel, or to plug up the AVMs, which are abnormal connections between the arteries and the veins. And then for the other types of problems, we can also treat some of these with surgery, where we can clamp off the abnormal connections or clamp off the blood vessels so that the abnormal place cannot bleed anymore.
Okay, now if you've done everything possible to eliminate the risk factors for a stroke but still have a stroke, what can you do to treat the stroke while it's happening? That's a good question.
Absolutely. And fortunately, these days there are many things we can do. And again, as Dr. Reichwein mentioned, the key is to come in early and get medical attention early. The sooner you get in, the more options you'll have. And the first option really is if you get in within 3 hours, we can do something as simple as giving you a drug in the vein. Very simple. That's the only FDA-approved drug, the tissue plasminogen activator, or TPA. Now, if you come in after 3 hours, between 3 and 6 hours, then we can use a catheter procedure where we drive a catheter up into the brain and deliver the drug, the same drug, directly into that blocked artery. But that is a lot higher risk, so 3 hours again would be the key. After that, between 6 to 8 hours, we can use other devices to come and try and pull out clots, sort of like corkscrew, roto-rooter devices. Wow. And then after 8 hours, there's even still things we can do, but these are more experimental.
Sure, but it sounds like there are a lot of options, a lot of things you can do.
Still a lot of
that
things.
In itself is very encouraging. So, Amanda, I know, Amanda Martin, the phones have to be ringing out in the call center. Tell us about that.
They are, Chuck, and with us now is a patient from Penn State Hershey Medical Center who experienced a stroke. His name is Frank Byrne. Thank you very much for joining us and sharing your experience. First of all, tell me a little bit about what you felt when this came on.
The first thing I noticed was I was losing the feeling in my left hand. I was dropping things that I had in my left hand, and I wasn't even aware of dropping them except I heard them hit the floor. And then I went to get keys out of my left pants pocket, and I couldn't feel anything in the pocket. And that was really the only thing I was noticing. And I didn't know what it was, and I was unwilling to think the worst.
Well, and the other thing is you're a competitive runner and cyclist, always been in great shape. You said you run upwards or about 30 miles a week. Yes. So you just didn't expect this.
No, not at all. I thought it was in very good health. I get an annual physical, and all my blood work is excellent. Cholesterol is 160. The HDL, LDL were low. I mean, right where they should be. And I just never expected this at all.
So then what do you tell patients that may be in a similar situation?
Well, as I said, I felt like I was in such good shape it couldn't happen to me. Nothing, and that was the worst of this. I was so surprised that no one is really immune. As healthy as I know I'm a very healthy person. You never know. And
so again, the importance is always knowing the signs and symptoms, and also knowing that if you don't know what's going on, it's best to seek immediate care. So nice to see you have no lasting side effects and you're doing well. Thank you very much for joining us.
You're welcome.
All right. Chuck, another great story, and this was an important one for receiving immediate medical care.
Yes, and when you hear his story, he shouldn't have a problem. He runs 30 miles a week, so that brings out the importance. Thank you, Amanda. Appreciate that. And Dr. Cockroft, thank you very much for coming in, being one of the doctors here in the panel. And, of course, you can go back, and if you want, join him in the conference room and see what's going on.
Thank you.
At this point, post-stroke rehabilitation is important to help patients relearn their skills that they lost from brain damage as a result of a stroke. Up next, we'll take a look at how Penn State Hershey Rehab Hospital helped one man through his recovery.